on a lot of initiatives, David Morse. And before we get fully underway, I want to remind everybody that by staying on this call, you are okay with us recording it and also streaming it live so that those who are not able to necessarily watch with us now can also see it later. And Mr. Morris is like an amazing gift to our community. He is a Harvard graduate studying European history and also graduate courses at the University of Louisville. And he gets that centeredness from his work in Buddhism, where he studied at the Han University. He is a retired veteran, worked in the Army Reserves, and is on a number of professional committees from government level as well as community level. And we are just really so excited to have the treasure of him working with us in Sarasota as part of the Men's Health Initiative, the Men to Men Prostate Cancer Awareness Group. We really appreciate David's commitment and determination. He is one of those guys that, as they say, gets the job done. And they have regular educational programs that he's going to tell you about and a little bit more about the organization. And for those who want to continue to be part of the support and to learn more about what's going on, we hope that you will follow through with the group. You also can find this information on our website, www.v-mhi.org, and our Facebook. We always have a lot of different cool things going on. And if you'd like to join our newsletter, sign in at the bottom of our website, www.v-mhi.org, and get on the newsletter list, where we'll also list links and flyers and communications about things like this wonderful program. We will be looking on our Facebook live stream. So if you have questions and comments, put them up there, or you can send questions to info@v-mhi.org. So Mr. Morse, thank you so much for being with us. And at this point, I'm going to turn you over to our technical team. I think you might have some images to share. And if not, then you can just get to talking and we'll be happy to listen. And for those registered, you can put questions in the chat. And if you're not talking, please would you mute your mics, especially with all the thunder and everything going on.
Right. We're mutually hearing thunder, both at my end and at yours. So I'm sure we'll have to accommodate for that. But thank you so much for quite a wonderful introduction. I'm not sure I measure up to all the things you said, but somewhere in written form, I guess some of those things have been accomplished over the years. I guess I wonder sometimes how I came to be working in men's health. And it's really pretty simple. In my early years, I was working way back when, and some of you may remember or may not, but the Great Society and the poverty program, this is now back in the 60s and 70s, was a dominant feature of the landscape at that time. And I spent a considerable amount of time working in Boston, Massachusetts on getting kids into better and better living situations, better and better job situations, and getting them educated as best we can. One of the things we did way back when, and the program still exists because just a week ago I was in Boston and I visited the original DARE house. And DARE was a program that we started back in Boston for residential care for young kids, and kids that were in situations of delinquency or homelessness or any number of very difficult situations. Very broad community, white, Black, Hispanic, a very mixed. Boston was a very mixed city, still is. And so that was kind of my introduction to caring about other people. As I got older, I spent a fair amount of time also in with the State Department overseas, working in Southeast Asia. And again, I found myself working with people that really, really needed help. These were refugees from the north part of Vietnam that were coming south to just avoid conflict, trying to find homes, trying to build families, trying to rescue family members that they had lost. And so that again was a step sort of in the direction of where I think I've ended up now. in my later years. I hate to use that term, but certainly it is true. So I was kidding a friend of mine the other day. I said, we better keep working because we've got a lot to accomplish before the time is up here. He likewise is about my age. And so, but what really prompted me mostly was the fact that my father was diagnosed in 2000, I guess about 2000, with prostate cancer. And he went through the battles that many of us men have gone through and are going through to try to figure out what course of action to take, what should be the best diagnostic treatments, what should be in fact, the best treatments for the disease itself. And trying to weed through all that, he did not have much support. He had his doctors, which is what we all tend to rely upon. And beyond that, he didn't really have much support. He had my mother, his wife, and friends and family, but not very well informed sources of information. So that was kind of a hint to me that something's missing in men's health. And there is a lot missing in men's health. And I don't like to be a complainer because I think that gets in the way of getting things done. But the fact is that men receive far less support financially and public relations wise than do women. For example, with prostate cancer, the numbers are virtually the same for disease accounting and death rates between prostate cancer and breast cancer. And yet the finances of the two things are dramatically different. For example, the American Cancer Society spends $153 million a year on breast cancer. It spends $53 million on prostate cancer. So it's roughly 3 times. And yet the disease is roughly equivalent in terms of measures of how it impacts society. I do think that men have get the disease later in life, so that may be borne in mind as to why the numbers are a little bit lower for men. But the fact is that men don't speak for themselves either. We have a tendency, and I'm as guilty as any, but I think I'm gotten over it a lot because of the role I'm playing. But we don't like to speak about our own health unless we're in a locker room or unless we've been in a bar room where we've had a few beers or something. But typically we don't open up to people who could be very helpful in terms of support. We tend to keep everything inside. We don't want to talk about our sexual lives or the impact of prostate issues on urinary tract disorders and a lot of other very personal things. So the tendency is to simply let it go and deal with the doctor as best we can, but not get the kind of support that I think is critical to the whole process. And thus we got involved with this support group that was started by Sarasota Memorial Hospital over 30 years ago. It was started by a couple of patients and doctors at the time. And it was called Man to Man. And the group was meant to bring patients in to just discuss with other patients and with a doctor what their concerns are in a personal way. They would have a doctor on site at the time so he could provide medical advice, but at the same time there's so many emotional and family and other factors that really played on how people were going to survive this thing, that had to be dealt with as well. And that group, starting, I guess, as I say, over 30 years ago, has continued to this day. And that's a pretty remarkable thing, I think. So there is some stubbornness left in men. We don't give up too easily sometimes. We may be quiet, but we're stubborn. And this process has continued right through the COVID season, when the very first month that the hospital shut down such meetings, we turned to Zoom, which was relatively new, certainly to most of us. And again, as I say, us people in our later years, we don't know very much about technology. I have come a long way, I've got to say. I even got on this call tonight without too much difficulty, so I guess I'm learning. And the other guys are learning too. In fact, we've had great success with the Zoom calls over a 2.5-year period, where sometimes we've had as many as 30 or 40 men joined And that's on Zoom, not just in person. We like to do it in person, of course, and that's been the strength of the organization. And we'll continue to do in-person meetings. We also are doing what we call hybrid meetings, so that our next meeting, for example, is on Monday, next Monday, and we'll do it both by Zoom and by in-person contact. And what we've done earlier
Excuse me, David, can I ask you, if somebody wanted to be part of that, do they have to be a membership in the group, or how does somebody access that? I see we have prostate.org, prostatesarasota.org. Is that your website? Can they go in there to register, or?
Yep, that is really the best way, but it's really open to anybody. We try to be very open to even somebody finding out about us the day before. And yes, absolutely. There is no membership. Everything is free. The meetings are open to all, and we encourage partners to come. By partners, I'm referring to, in the case of gay couples, certainly men of gay persuasion. We also want women to come if they're partners of the men we're talking about, because the second person in a partnership is really critical to surviving these darn diseases, because they get to talk to the doctor as well. In fact, we encourage that. We say, bring in another person to a doctor's visit, because they will see things that you don't see. You're so emotionally involved, and you may not ask the right questions, or you may not ask a question that really is quite obvious, but may not be to you. But yes, we would encourage everybody to come. It's really a burden on us to get the word out. In fact, that's probably my biggest challenge, is to make sure we get the word out. And earlier, Dr. Merritt, you mentioned partnerships, and quite honestly, I've learned a lot about what partnerships mean in something like what we're doing. And the partnership with, for example, the Multicultural Health Institute has been phenomenal. And some of the other agencies in town, we first partnered with Goodwill of Manatee at the Selby Center. And what we are doing at Goodwill is every third Saturday, we run a PSA testing clinic, screening clinic, which means that any man that wants to can come on that Saturday morning from 10 to 12 and be tested for PSA, which is the most significant measure of whether you have prostate disease or not. And we encourage men, at least from age 40 on, to make sure they're getting PSA tested. And we get the results back to them within 24 hours, 48 hours, and they can then determine whether they need to see a doctor or not. And we give them some guidelines as to what they need to do. But that has been.
And can I also point out on that, I believe that's a great partnership with Lab Services.
Absolutely.
And Mary Barnes, who's one of our board members.
Absolutely.
And they also help. We just this past weekend did similar screening at the First Home Bank and the financial literacy program that we do. So twice a month, the community has access to free lab testing, which is so important for the prostate screening. Like you said, the PSA can sometimes be creeping up before anyone has any symptoms or any understanding about it. That's right. Or if they have a family history, they may have a lower threshold to want to check themselves and screen that, because like everything, the earlier you can get a change in the trend, the easier it is to treat and the better outcome is achievable with less difficulty and challenge. So I'm really glad to hear you mention that is a blood test. Yeah. It's not the digital rectal exam that a lot of people fear, although really you need to have that too in the doctor's office. But this one is just, it's very doable. It's not such a big deal, right, David?
That's correct. It really is. That's a key point that you mentioned, because a lot of men of every persuasion are concerned about the DRE, the digital rectal exam, and they're constantly saying, oh, I'm not going to go through that. And a lot of doctors have stayed away from it recently too. So, but the PSA test is very simple. It takes maybe 5 minutes. You come and sit down. We have a phlebotomist who does a blood draw from your arm, and that blood is simply taken to the lab that day. And within 24 or 48 hours, you get results. So, and it doesn't hurt. I mean, if everybody's afraid of needles to some extent, but I do it without fear at all now. But maybe that's because I've done so many, but in any event. But again, the partnership thing that you mentioned, yes, lab services, of course, has been huge. In fact, they were very big behind putting together the Robert Taylor Center COVID testing site as well. And another partner who's been terrific, and they just moved into the community, and I think it's a critical component to the community, is Bay First Bank. They've been terrific. Carlos Yancey, who runs the office right there, it's coincidentally right across the street from Goodwill, has been terrific. And in fact, is an interesting story I should tell you, which I think is reflective of what we would like to be able to do a lot. And that is, we had a gentleman come by. He walked in to the PSA testing, had no idea what PSA testing was, saw a sign, and Carlos kind of knew this person, so he went out and encouraged him to come in, and between Carlos and I and the phlebotomist, we talked him into having a needle put in his arm and be tested. And we explained what it was and told him about it, gave him some paperwork, and let him go on his way. 48 hours later, his results were available, but nobody knew how to reach him. For example, he had put down an incorrect address or something that wasn't legible, and he didn't have an email address. So it was, there we were kind of stuck. And the doctor who was concerned about this, Dr. Dwight Fitch, who's a remarkable guy as well, said, you know, we've got to get a hold of this guy. So Carlos and I and our phlebotomist, Crystal, found ways. Let me just say, we put our best detective work together, and we found him, and we were able to get him to a doctor to check it out, because he did have a higher than normal result. And of course, during all of this, we had to be very careful, because we couldn't know what that result was until we physically were able to give him a sealed copy of it. And then he asked about it. So, but anyway, it was kind of a wonderful story, because it really achieved the objective that we need to achieve on a larger scale. And so I'm very happy that we've done this, the PSA testing. Sometimes we don't get more than 2 or 3 guys on a Saturday, but other times we'll get a dozen, and every one of them is very important. So that's kind of, I'm maybe running out of time a little bit.
Yeah, no, we're good. I wanted to
Okay.
ask a couple questions and bring
Sure.
up a few comments too.
Yep.
And why in particular have you focused on Newtown? Why is that important for this group to focus these efforts in Newtown? Could you expound upon that a little bit?
Very good question. The history of medicine in general, I think, has been that Black communities don't, for whatever reasons, don't get the same treatment that white communities get, which means that Black men are very likely to suffer consequently much more from something like prostate disease than white men are. And the numbers reflect that. The numbers are quite significant in that Black men have rates of 3 or 4 times the number of deaths and the number of incidences of prostate cancer. So, and there are a myriad number of reasons behind that, but it is a fact, and it's been noted over the years that that's the case. So here I am right in the middle of Sarasota, and to me, Newtown has always been really the core of Sarasota. You know, I mean, it's been where the history is. And when I first wanted to do something in Newtown, the first guy I went to was Willie Shaw, former commissioner and mayor of the town. And I had already met him a few years earlier, because he had had a prostate cancer battle. So he was quite familiar, and he has been just a wonderful encouragement to me I was sitting at a meeting with him one day, and I said, you know, we're trying to do this and that. He said, you're not trying. He said, you're doing it. I thought, okay, no more am I going to use the trying term. I'm going to just.
That's it. Yeah, I was actually talking to him today, and he was happy to hear that we were getting the messaging out again tonight. Yeah. And you're right, it's significantly more prevalent and more deadly in men of color, and also they tend to get it younger. Yes. And unfortunately, it's one of those things that can be very, what we call insidious, like it can be there a long time. Like many older men may have changes of prostate cancer when you're up in their 80s and 90s. It's fairly ubiquitous, right, but it's maybe not as much aggressive disease, and it may even be an incidental finding looking at other things. Mm-hmm. But with the kind of screening you're talking about and the kind of the different types based on something called the Gleason score in terms of the aggressiveness of the cancer. That unfortunately Black men might have a not the best kind of score, which means that they may be more prone to it being aggressive, to spreading outside of the prostate, getting to other organs, the bones, etc. So like anything, before the train is leaving the station, it's easy to jump off. It's easy to deal with things. If we can find something early, it's a lot easier to nip it in the bud, as they say, and to keep on with your life and good quality of life.
Yeah.
And the treatments and the options have gotten really, really good. There's a lot of different ways to deal with prostate cancer. It used to be not many, and most of them were surgical with not the best outcomes and a lot of complications.
Right.
But fortunately, as I'm sure you guys talk about in the program, and I'm sure Dr. Fitch even talks about, depending on the stage of the disease, the other what are called comorbidities that the person might have if they have other health conditions like diabetes or high blood pressure or prior cancers or whatever, an individualized treatment plan can be put together. And sometimes it's even non-invasive in the sense that it's radiation beams. Like they have this amazing external proton beam stuff. It's like something out of Star Trek where they just kind of zap it from the outside, right?
It is.
And it requires a commitment, it's kind of like daily for like 3 weeks, but it's like you just zap that thing out of there. So there's a lot of possibility. If you don't find out, if you don't come talk about it, if you don't hear people's stories and how they cope with it and know that all of these things are manageable, then you may sit around worrying yourself, and then the next thing you know, you have a really far bigger problem and fewer options to overcome it.
Right.
So I love what you're talking about in terms of getting people together. And then, what are some of the risk factors? Well, certainly family history is a risk factor.
Yes.
And unfortunately, part of why it seems to be higher in Black people is because of the higher stress level, the environmental impacts, the toxicities, kind of work. And so we need to be aware of that. And how do we counteract that?
Right.
Well, we had a really good push with the CDC and other health organizations about 9 a day. People, I start bringing this up, they're like, Dr. Lisa, that don't make no sense. Yes, it does. 9 servings of vegetables and fruit a day. That's 3 a meal.
Yeah.
So if you have in the morning, you throw some tomatoes and some onions and, a little spinach in your omelet or your eggs or something like that. There's 3 right there. Yep. I put zucchini, bell peppers. Yeah, then you're ahead almost for the day, right? For serving. Then at lunchtime, you have yourself a nice salad. You put a lot of things in the salad, a lot of green things, not too much with the cheese and the blue cheese, because then that sort of neutralizes the salad effect, right?
Yeah.
And then for dinner, and your plate should always be half vegetables.
Yeah. Yeah.
Okay. Too many people have the plate as half carbohydrates, big plunk of macaroni and rice, and we don't need that much. That's a quarter of the plate. Yeah. Same thing with the meat. We grew up in a mindset, to have meat was that you were doing well and you were getting strong. Well, we now understand that too much of the meat is not good for your heart because of the fats and things like that. Yeah. I'm not saying everybody has to cut that out. Everybody has their different preferences. But we do know that what you eat contributes with the kind of things that grow inside of your body, the microbiome, the bacteria in your system. And that meat tends to promote a certain kind of fermenting bacteria. And fruits and vegetables and fiber, high fiber, promotes more beneficial, healthy bacteria. There's a book called Inflamed that I love that I'm reading now. And they talk about the importance of promoting those good, healthy bacteria in your microbiome. And even certain cancer treatments now, they recommend that you have to be on certain probiotics and have certain bacteria in your system to optimize how the cancer treatment's going to work, because they need the effect of the bacteria and how they break things down in your system. Yeah. So it's gotten a lot more interesting and complicated, but there are things in people's reach that they can do to be well and to take good care of themselves. Yeah. And then, of course, there's always exercising. My favorite thing, right? You got to exercise. Okay, it's good for your heart. It's good for your mind. It's good for your circulation. It's good for your blood sugar. It's good for your weight, which is good for your joints. I mean, you can't lose with exercise unless you do too much of it or the wrong kind. Yeah. Or out in the heat in the middle of the day without enough hydration. Okay, that's not be sensible.
We do have to be very careful here in Florida.
Got to be careful in Florida. So are there any questions coming in? I'm not seeing any particular questions, but I did want to ask, where can people go for treatment? Like, what kind of doctors did your dad go to? What kind of doctors do people need to see if they're trying to figure out where to start?
You know, what typically happens is that once you're a general practitioner, you sort of have to start with your general family practitioner. And that doctor is kind of the initial screener to determine whether you're subject to or potentially a prostate disease victim. And you've got to rely upon that doctor. The next step typically from that general practitioner is to refer you, if he sees signs that you may be having trouble, to a urologist. And that may or may not be the best solution. There are lots of doctors that really affect how you deal with prostate cancer. A urologist is certainly one of them. And the other ones are radiation oncologists. Well, those are the two primary ones, I would say. There are also specialists in such things as many of the treatments you mentioned earlier, such as cryotherapy, for example, or HIFU is another treatment. Most of these fall under the category of radiation or some related type of treatment. But the urologist is the first guy. Now, the urologist, the only drawback to a urologist is that they're typically trained to operate, to remove the prostate. So there's a slight bias on that doctor's side leaning in that direction. So I just, when we have new patients, new people that come in, we say, just be aware of that strategy or that bias that they might have, and be prepared to talk not only to the urologist, but to a radiation oncologist or one of these other people that specialize in a different treatment, and make sure you understand the possible treatment options. And they are numerous. They are so numerous that one of our medical advisors years ago used to say, it's so confusing. It's confusing to us as doctors, let alone
Right.
what you patients have to go through. But the thing to encourage is just getting out there and getting the information. And I think that's where the support group helps, because once you have a support group meeting, you have 10 or 15 other guys there, and each one has his own story. And there might be 4 or 5 different treatment options that these 15 guys have used. And some of them have used no treatment, or what they call active surveillance, or what I call aggressive surveillance, which is a waiting period, which a lot of doctors are now, and even the AMA are recognizing as a legitimate treatment process. So you might wait 3 or 4 years before you do anything aggressive, or you may never do anything aggressive.
Yeah, and I think it's also important to point out that there are different things that can raise the PSA. Prostatitis, inflammation, infections, other things. Riding bikes for too long. Ask Lance Armstrong about that.
Yep.
So it's important to really know the whole clinical picture. Right. I also put down a hematology oncologist. An oncologist is the cancer specialist overall for like all different kinds of cancers.
Yeah.
And it's often a team. I'd like you to bring up. And what is that comfort for that person? We have a caregiver organizer manual as well that we're going to be pulling back out again to market to people to be able to have, because one of the things that makes it a little less overwhelming is if you have a system of operation to organize your records, your story, information that's coming in, your insurance information, who you called for what, who you might call for what. And a lot of times we work with the caregivers, the partners, because that's kind of their role, because they're not going through it, but they want to be helpful. And often the person going through it is so overwhelmed, just trying to go through it. So a good team effort is to help, encourage, and inform them. So that's something maybe down the line our care navigators could come and talk with the group about, how we help navigate, and also how you keep up with all your other stuff.
Right.
Because the prostate cancer may just show that, well, yeah, and how come your immune system was down? Well, it's because your diabetes is totally out of control.
Yeah.
So we have to optimize all systems and make sure you've got that under control, make sure your blood pressure is under control, because the last thing you want to do is have a diagnosis of prostate cancer and you've had uncontrolled diabetes or blood pressure situations, and then you have a complication and you end up with a stroke or a heart attack because of those things on top of the cancer. And so you have to get stable and go to rehab for those things before you can deal with the cancer. I've had cases like this. So it's, it's the totality. So that's why a good primary care, family practice, doctor, nurse
Yeah.
practitioner who really knows you and you have connection with and can
Yeah.
talk with is important. But we also feel what you're doing, David, is so critical because the outcomes and literally the prognosis and the life expectancy, there you go, for people in groups is better if they're in a support group of some type. That human connection has value. And I just want to bring also to the conversation, because I believe that that's Dr. Mike is down there. I'm not seeing his picture. I'm not sure if that's Mike Weddle, but we have a mind-body program that we're working on and training our care navigation team, because we understand the incredible power between the mind and the body. And so getting together to talk is one way to help encourage and deal with stress, etc. And then there are other practices and techniques that really are powerful in helping to sort of galvanize your immune system and help keep things in a more balanced state when it comes to those things like the diabetes and the blood pressure and everything. If you practice these techniques, it helps you stay in a more balanced state. You know, I mean, I deal with a lot of stuff all the time, but they're always amazed when they do my blood pressure and it's like 97 over 50 or what, you know, and I was like, because I meditate every day. You know, and I'm not saying I'm perfect or anything, but I do really believe that if you learn on moment to moment how you just sort of do these resets and don't let it add up and be in your body, and men in general are often socialized to just hold it in, be strong, be tough, John Wayne, you know, that's like not real. We know that. It's much better to talk about stuff. It's really okay if men cry. You know, you're a human. You have tear ducts for a reason. You feel pain too for a reason. Okay. And there was a question here for you, David. What kind of social barriers have you noticed for men trying to have like hard conversations? And what strategies do you use to navigate those barriers?
There are a couple of things we do. The first step that I normally do with somebody who comes to us unannounced, let's say, but they call or they send an email, is I try to talk to them at some length myself before steering them in any one direction. I might not even recommend that they come to a group session if I can tell that they're not comfortable with that environment. And we have a couple of other people. We work very closely also with Team Tony, who you may have heard of, that does one-on-one peer counseling also for all cancers. And but that one-on-one scenario is pretty critical, I think, for the most part. It really helps give you a feel for what this person needs. And in some cases, they just need to talk to you time and time again, maybe 10 times over the course of a month or two. It depends on their situation, very, very much so. Where are they in the diagnostic process? Have they been diagnosed, and are they facing a doctor that they're not particularly happy with? How do you deal with those sorts of situations? So we try to feel that out a little bit in the beginning. Sometimes people will just arrive at a meeting unannounced, which is great, and we'll just allow them to mix as they feel comfortable mixing. And that sort of comes out, you know, if you see somebody come into a meeting and they don't say a word for an hour and a half, and then they start to walk out, they're not going to walk out without my stopping them and saying hello, and, you know, at least, or one of the other guys doing the same thing. Everybody's pretty sensitive about that, breaking the barrier, so to speak.
And does that come from some of your experience in the military too, your ability to relate this way to that kind of group guy experience thing?
Yeah, you know, I graduated from an Ivy League college, and 6 months afterward, I was in the military. And I will never forget that within 3 months of my time in the military, I kept saying to myself and others, what an education I'm getting here in the military as opposed to what I just went through 4 years prior. I mean, not to disparage the education in the Ivy League, but the military is a marvelous grooming spot for just life in general. Yep. And learning how to mix with people from every possible imaginable background really helps. Yeah.
So are there any other questions from anyone else on the call? Andre, we're happy to see you. I want to introduce Andre McClurkin, our new head of the Community Health Action Team and equity work at the Sarasota Department of Health. Nice, young, bright, shining face, and is going to help bring more of this messaging and working so hard and so well with everyone right off the bat. We welcome you, Andre, and we're so happy to see you and know that we stand to support your directions and desires and what you're trying to bring to the community and public health efforts. And do you have anything you want to add or any questions you want to share?
I just wanted to say that it was a great presentation talking about the prostate initiative and just learning about your experience and how you kind of foster that group mindset and really, like peer-to-peer, making sure that people are okay, caring for them in a wholesome way. So I definitely appreciate you talking about that initiative. And thank you so much for letting me be here. This is wonderful just to hear about. And I definitely look forward to working with MHI and all of the other organizations in the future. So thank you.
Excellent. Well, we're so happy to see you. And Andre also went to a very good school and is now applying all of that knowledge. Well, it's been out for a year, but applying that knowledge. So always happy to see inspiring young minds. MHI has this scholar program, and we're so excited when our students go on into any type of science or health or engineering, or even arts and math. That STEAM age is our thing, because they're the innovators of tomorrow. And, the more that we can help ground them and support them and give the information, the more of them to take care of us, right, David?
And we're going to need it.
We're going to need it, man. We're in a situation. Okay, Onyx, did you have any other questions? Chief, did you have any questions? Because we're at time, I think, and it's been a good conversation.
No questions. It's a great presentation, great topic.
Thanks.
Excellent, very timely. I think you may have saved some more lives tonight, David. So remember that, everybody. If you or someone you know or love is dealing with prostate cancer issues, you can get information from the prostatesarasota.org website. You can come to one of their free support groups. You can contact David Morse, who is an amazing force, a one-armed force, is connected to a lot of different good resources. Yeah. You can reach out to Andre in the health department with the Community Health Action Team and find out about other resources in the community and supports that are going on. You can go to the www.b-mhi.org website, and under the Know Your Body Health section, we have all kinds of information and resources there. You can also navigate through there to our dashboard that has updated statistics and resources within the community for a variety of social determinants of health. So we thank everybody for sticking with us on a stormy evening. We thank the techno gremlins for being nice and not interrupting our transmission. Right. And we thank everybody for the attention. And the third Wednesday of every month, we'll be back trying to come up with an interesting topic. Let us know if there's something you'd like to hear about. We're following the National Health Observances, a different menu that we work together with the health department to help to spread the word coherently and reinforce to one another all types of health objectives, many of which were originally started by Dr. Satcher, an amazing African-American Surgeon General who had the vision to create these healthy people, 2000, 2010, 2020. We're now working towards the 2030 objectives. And may I just close as we do talk about sexual health issues, that HIV/AIDS, National Health HIV/AIDS Testing Day is June 27. You can always get tested through the health department, Community AIDS Network, which has now got a different name. And we're also working to support and believing in the possibility of the objective to eradicate AIDS by 2030. There's a whole goal and a whole treatment protocol towards that. But just like with COVID, the best thing we can do is protect ourselves. So safe sex, use condoms, get tested regularly, know your status. And with regards to the COVID pandemic that we are still in, do not be fooled. Remember, masks in congregate settings. Get vaccinated, keep your vaccinations up to date. Wash your hands, keep your distance. If you feel symptoms, get tested. Even if you don't feel symptoms, if you're out and about regularly and not wearing your mask, please be tested so that you're not in the chain of transmission and that you can protect not only yourself, but those vulnerable in our community that we want to keep from getting COVID if we can. So thank you all for the attention. David, did you have any last things to share that you wanted to add?
Just very glad to see Andre there, and we started connecting this past week, so I'm looking forward to more and more for between the two of us.
All right, so the third Monday at 2 p.m., the third Thursday at 6 p.m., prostatesarasota.org. Hope to see some of you guys. Come on out there. Come on out there now. Take
Thank
care of
you.
yourselves. Let's talk about it. Let's deal with it. God bless and thank you all for your attention. Okay, Chief, we can cut the